So we were able to, through the SHIP grant, write an innovative application to the Department of Health, and we're funded to really look at how do we increase access to healthy beverages by working with different organizations such as Tony Downs, looking at their vending machines. Do they have water available? Is there education to the employees about the types of beverages and the amounts of sugar that they have in the beverages? Since we've worked with Tony Downs since the beginning of SHIP for the most part, we've been able to work on developing a comprehensive worksite wellness policy that incorporates things like tobacco-free grounds, also looking at improving physical activity opportunities.
Well, basically we're getting together every month, some workers and me and some coordinators, and we talk about the needs, what they need, what they want, and we've been doing this health awareness program every month. For example, we did blood pressures last month, and we're going to be checking cholesterol and glucose.
Many of the people that are working here don't understand how to go to a doctor, who you should talk to about a specialist, how to take care of themselves. Some don't understand what cholesterol and triglycerides are. Some we've discovered diabetics, they didn't know that they were diabetic, they had no idea what the symptoms were. So education is a big factor. We tell them what to look for, and to prevent it, what you should eat, what you shouldn't eat, how to exercise, things like that.
Well, basically right now we've just done blood pressure, and we're gonna start educating about glucose and cholesterol, why is it important to check it, and what to do if it's high or low. And we also talked to them, and they talked among themselves, which is really good to see what they needed, what they wanted. So, and we also did the garden. This garden project, we talked what they wanted to grow. We're trying to make them grow their own vegetables. And we had 10 different seeds. So we brought the pots, the soil, and they got to choose. And it was really fun, and talking about how they grew, and everything was really, really good, and they shared their vegetables. So that was really interesting.
I stay in the program Welness, and we like to invite the people to explain everything about the barrel we planted. And we have like a garden outside. We don't want to make a big garden, but we like to explain to the people we grow in like a 2 seed or 3 seed in the same barrel, and it was growing good. And we have tomatoes and also cucumbers, and it's about 60 people. They bought the barrel. It was everything inside, and also the planted tomatoes, the jalapenos, different kind of stuff.
They seem to like it. In this plant we run a health and wellness committee, and once a month they get together and they discuss what they'd like to learn. So obviously we did a garden because they wanted to learn how to grow vegetables, and we wanted to teach them what's the healthy vegetable, which vegetable should you be eating.
The healthy was good. That's because when somebody has had a problem, we let us know to the supervisor, and they take to the office and help. Whatever problem we have, they help you and take like therapies or something to help us.
We're part of the Madelia community, and we need to give back. And giving back to our employees, who obviously live in this community also, is just one way of doing it.
We're talking about the importance of drinking water or not soda pop. I'm actually doing right now is a lot of drinks that Mexicans have. They're not all from here. So what I'm getting is how much sugar they have, and also they have it in metric system. So I'm changing it so they understand exactly how much it is here. So they can actually see it and visualize, well, here it is, because sometimes they think tea. Well, it's not the natural bag. They buy the bottle, and that has a lot of sugar. So we're trying to show them how much actual sugar is in it.
I have lived in Madelia my whole life. I was born and raised here, and it's good to see the changes that are happening. It's slow, but they're happening. The change in the kids' activity, kids walking to school, riding their bikes to school, reaching for water instead of the sugary beverages. It's happening, and it's good.